I'm Dr. Boland, board certified neurologist. The name of my practice is Mobile Neurology. And today we're here to talk about the pillars of brain health. And there are 6 pillars of brain health developed by Cleveland Clinic. Number 1, food and nutrition. Number 2, exercise. Number 3, medical health. Number 4, socialization. Number 5, sleep and relaxation. Number 6, mental fitness. So today we're going to focus on the 5th one, which is sleep and relaxation. And believe it or not, having adequate sleep really does make a huge difference in our brain health and our cognition. So people always ask me, how many hours of sleep do I need, doc? And they say, I'm fine on 4 hours. Some other patients tell me, oh, I need 10 hours, 12 hours. What the research has consistently shown over the years is that everybody's sleep need is pretty consistent. It's right in that 6 to 8 hour mark. If you tell me I need less than 6, that's not necessarily true based on research studies with the circadian rhythm patterns that we've identified. You really need somewhere in that 6 to 8 range. Now, some patients need only 6. Other patients need 8, but it's always right in that 6 to 8. Number 2 is sleep hygiene. You need to have good, adequate sleep hygiene, and we'll just talk about that in a minute. Number 3 is chronic stress is a major risk factor. And the 4th area is relaxation. And this is very important to have integrated into your daily life. And there's different levels and phases of this. You can just do some simple relaxation, lying on the floor, doing deep breathing, to meditation, and to mindfulness and yoga and things like that. What we found is that 12 minutes per day of yoga has significant brain boosting benefits. We know that, we've seen that time and time again. So now, talking about sleep hygiene, what are the sleep hygiene things? 1, sleep in a cool, dark room. 2, no electronics in your bed. 3, no reading in your bed. 4, don't stare at the clock. Number 5, if you perceive it's been about 2 minutes, again, not looking at the clock, whatever your perception is, it doesn't matter if it's actually 6 or it's 11, but around 10 minutes, if you haven't fallen asleep, you get up, you get out of bed, you go to a different room. In that different room, you sit quietly, dimly lit, and read something relaxing. When you feel as though you can go back to bed, you return to your bedroom. And you keep repeating this principle until you're able to fall asleep. And if you don't fall asleep again in 6 minutes, 8 minutes, or 12 minutes, you get up and repeat the same thing. If you awaken in the middle of the night, you do exactly the same thing. Whatever the time it is next that you fall asleep at night, finally, if that's 2 a.m., if that's 3 a.m., if that's 11 p.m., you back it up by 30 minutes. So if you fell asleep at 3 a.m., the next night you try to go to sleep at 2:30 a.m. And you keep backing it up by 30 minutes until you successfully fall asleep at your desired sleep time. And this is the principles of sleep hygiene. I'm Dr. Boland, neurologist, Mobile Neurology.